Okay, so let me summarize the question. So what we're talking about here is when to tap and when not to tap in infants. And the number you're citing here is 6 weeks versus 2 months. Just a little history here. When I was in my residency in the 80s, we were across the board tapping all children, regardless of any symptoms they had, if they had fever, 4 months and less. All kids, whether they had runny nose, whether they had diarrhea, whether they had obvious symptoms or not of any viral infection, all kids 4 months and under got tapped. What's happened over the last 25 to 30 years is that number has been slowly being carved back. And it's being carved back for a good reason. The incidence of invasive disease has dropped considerably. The two most common causes of invasive disease in children beyond the neonatal period. So group B strep in the neonatal period by far, overwhelmingly is number one, and it still is. That hasn't changed. We have cut down on group B strep infections in babies in the first month of life because of the protocols that came into being about 10 years ago, prophylaxing both the mother and sometimes the baby for group B strep. So what's been happening for a number of years now, a decade or more, is that the mothers are getting tested for group B strep prior to delivery. And depending on what's going on around the time of delivery, you might or might not need to start antibiotics in the mother or the child or both. That has cut down on the infection rate with group B strep, but it has not eliminated it. H. flu B and strep pneumo are by far the most common cause in the next few months after group B strep kind of fades away. H. flu B virtually disappeared in 1991. Why? Because of the conjugate vaccine. Up until then, we had a polysaccharide vaccine for H. flu B. Polysaccharide vaccines are not highly immunogenic in young kids. And in fact, you don't really get much of a immune response until you get to about 12 to 15 months of age, which is why that's when the vaccine was given. Well, unfortunately, the peak for H. flu B was about 8 to 10 months. So the horse was already out of the barn. The conjugate vaccine is a protein conjugate. The protein conjugate helps to make that vaccine immunogenic even in very small infants, down to 2 months. So we started giving it at 2 months in 1991, and it was like turning off a light switch. H. flu B was incredibly common in the 80s and before. In my residency and in my fellowship, I did my fellowship from 87 to 91 in ID. And in that fellowship, we had at any one time 4 to 8 kids on the ward with H. flu B disease. Buccal cellulitis, epiglottitis, meningitis, sepsis, osteomyelitis. We had all this on the wards at all the time. There was never any time we didn't have H. flu B somewhere on the floor. When the conjugate vaccine came out, it disappeared. Strep pneumo conjugate vaccine came out in 2000 or 2001. We did not have as dramatic a drop, but there was still a very dramatic drop. The incidence of strep pneumo infections went down probably around 90%, invasive strep pneumo infections. And another bonus is that there is herd immunity from that vaccine, so that even adults, elderly folks, are partially protected because the babies are protected. If the babies and the young kids aren't carrying strep pneumo, they can't give it to the adults, and especially the elderly adults. Largely because of these factors, the age for doing TAPs has come down over the last 20 to 25, 30 years. Keep in mind that in the first month of life, the rate of invasive bacterial infections is still pretty significantly high. Some studies show as high as 10%. I will grant you that many of those are UTIs, but there's a lot of invasive sepsis and meningitis in that age group as well. Group B strep traditionally is thought of as being a factor for about 6 weeks. Most of us talk about the first month, but about 4 to 6 weeks. You'll start to see that kind of gray zone between 4 and 6 weeks where H. flu B, strep pneumo, meninge start to take over and group B strep starts to go in the background. And I'm not sure I've ever seen a child over the age of 2 months with group B strep. I'm sure it's happened somewhere, but it's pretty rare. So that's why this 6-week period is kind of a pertinent time to be talking about.